The Nigerian Correctional Service is advocating a shift from the stigmatization and criminalization of persons affected by substance use disorders in a more humane approach focused on rehabilitation, professional intervention, and reintegration. The call was made in Abuja at a two-day behavioral rehabilitation training designed to equip correctional officers with the skills to identify and manage substance misuse among inmates. Esther Oshosonya reports.
For years, substance misuse was primarily handled through a punitive lens. But however, the Nigerian Correctional Service is now advocating for a more compassionate approach centered on professional treatment and rehabilitation. Pharmacist Mohammed Bashir, representing the Controller General of Corrections, emphasized that this training aligns with the Nigerian Correctional Service mandate to reform the reintegrate inmates by addressing their core mental, emotional, and behavioral needs.
If you do the gap analysis, we are not where we are supposed to be, but we have actually left where we were. And with these lectures that we have received, we are very much in line and in tune. We have endorsed the partnership, and we are ready to engage them so that we make our system better.
There's issues of lack of understanding from our leaders on the roles that each of these professionals need to play. I feel that there's a little awareness, but with the increased mental health challenges that are coming up, I believe that there's increasing awareness. So I will ask that the government will support the professionals that need to do the behavioral change that is required so that our society can be better. There is no society, no professional that cannot deliver when it has the right support.
Consultant mental health and public health pharmacist describes substance misuse as a growing public health challenge, calling for a coordinated approach that combines prevention, treatment, and rehabilitation.
Averagely, roughly, Nigeria is having about 14.4%. The global level is 4.8 or thereabout lesser. And with Nigeria is currently over 3 times the global level. And WHO have said, if nothing is done, it's going to be an impending disaster. The BEN model is a combination of 3 models: the trans-theoretical model, the COMBIN model, and the socio-ecological model. And a BEN model says that for every intervention to be effective, 4 things must align. The individual must be ready, the constraint must be moved, intervention must be at the right context, and there must be a need for a reassessment. A BEN model is the answer to substance misuse prevention in Nigeria.
One of the challenges is that some of our officers, out of 10, you will have the bad eggs. Those that collaborate to smuggle illicit items will always put our security or the security of the facility in danger. So always try to educate them and tell them the dangers and the consequences if they are caught.
The 2-day training is expected to strengthen the capacity of correctional officers to apply evidence-informed rehabilitation strategies and improve the reintegration of inmates into society. Esther Oshosonya, STV News, Abuja.